150 years of history with the enduring partnership between medicine and public service that continues to move Arkansas forward. Governor, we also want you to know that the Arkansas Medical Society stands ready to assist you in any road that might be helpful as the state works through the Rural Health Transformation Program. We share your commitment to improving access and quality of care for every Arkansan, especially in our rural communities. We look forward to working closely with you and with our legislators in the coming year to strengthen our healthcare system, support our physicians, and ensure that every Arkansan has access to the care they need and deserve. Thank you again, Governor Sanders, for this tremendous honor and for your recognition of the vital role physicians play in the health and well-being of our state. And at this time, I'd like to invite AMS past president, Dr. George Conner, up to introduce the governor. Thank you.
Thank you, Brad. It is quite an honor to introduce our governor. I'm going to give you some facts. I know everybody in here really knows probably all these things, but I'm going to repeat them a little bit just in case there's someone here who doesn't know a lot about her. She is the 47th governor of the great state of Arkansas. She was elected first in November of 2022 and inaugurated in January of 2023. When she was elected, she was the youngest governor of the 50 states. I guess she still is. Are you still? And she was an interesting fact, she is the only daughter to follow a father who was also a governor of the state. In her short tenure as governor, she has done and shown several concerns for health care in Arkansas that we really have enjoyed seeing, that she has shown real concern about the health of all the state. It started, from my perspective, with the Healthy Moms, Healthy Babies initiative that she started to increase or to improve maternal care and neonatal care and try to reduce neonatal mortality. She's also started a ban on soft drinks, unhealthy drinks, and candy through the Supplemental Nutrition Assistance Program. And if you heard that, nutritional assistance, that sort of makes sense that we shouldn't be purchasing candy and such with it. So that's good to see that we will be using our money to help to give nutrition to the people who need it. And then she has begun this thing that's called the Bell to Bell No Cell, and that is stopping cell phone usage in schools during school hours by the students. It is aimed at helping mental health in the school systems. It's been shown that in some degree that does help the kids. So I think these initiatives are just really great. Also, she has begun this Natural State initiative to try to improve the citizens and tourists' experiences in our parks. That is so they will use the hiking trails more. It's really related to health in a backward way. So their citizens will go out and enjoy the parks and get healthier as a result. It is to promote year-round tourism in our state also. And I know, we share with the governor a common love for our state and a desire to improve the lives of our patients, citizens of the state of Arkansas. And we do appreciate you, Governor, for all that you do, and we do want to be a part of your program to improve health here in Arkansas. And it is with great privilege that I ask Sarah Sanders, Governor of the great state of Arkansas, to come forward and speak to us some of her thoughts and visions for our state.
Good morning. It is great to be here with this group and a great way to kick off a Monday morning. And Dr. Conner, I love that you mentioned that I was the youngest governor when I first got elected, but I do want to clarify I'm still the youngest governor in the country. But as I'm getting older and other people running are probably going to be younger, I want to hold on to that as long as I have it. But my youngest son, George, who's 10, is really tired of hearing me introduced as the youngest governor in the country. And my kids go with me to a lot of events. And George was with me several months ago and heard me get introduced that way. And I sat back down after I finished speaking, and he goes, "Mom, are you really still the youngest governor in the country?" I said, "George, as a matter of fact, I am." And he goes, "Those other guys must be really old." So they're totally unimpressed, but I'm going to hang on to it as long as I've got it. But I want to thank y'all so much for being here, and Dr. Bibb, the president of the Arkansas Medical Society, for your work with this organization and your leadership in Arkansas across our entire state. So thank you for what you're doing. And thank you to Dr. Connor for the kind introduction and, more importantly, for the decades of work as a physician in some of our smallest communities and the commitment that you have to helping treat and take care of Arkansans. And I want to say thank you to our team. I know we've got a lot of members from my staff and from the administration that are here. Dr. Patel from the Department of Health, who's been helping lead the charge, I know, on this event, but also every day through his service and commitment at the Department of Health. Renee Mallory, Secretary of the Department of Health, Secretary Janet Mann, Secretary at DHS, and our Surgeon General, Kay Chandler. I don't know if you notice a theme over there, but we have a lot of strong female leadership helping run this administration, and really proud of the team that we have and the great work that they're doing on behalf of our entire state. And I also want to say congratulations on the 150th anniversary. I know that this is a big moment and something we are excited to celebrate and be part of. Dr. Lowry Barnes from UAMS, thank you for your great work and the leadership that you're providing, and for even accepting late night phone calls when one of my kids is sick or injured and headed to your ER. So big fan of your work and all that you're doing to help us lead here in the state. I know most of you probably are aware that I spent a couple years in D.C. and proud of the time that I had to serve and live there, but we couldn't get back to Arkansas fast enough with our family. You know, when you have 3 kids at home, you never really expect things to be very quiet, but after a couple of years in the White House, we were looking forward to our return back to Arkansas, taking a little break before things really geared up, and I started to run for governor. Unfortunately, things got derailed right there at the end, and in 2022, I was diagnosed with thyroid cancer, and it was something that was a really hard time for our family. You know, it's never a good time to hear on the other end of the phone line that you have cancer, but it's especially bad timing when you're running for governor. But our family kept the faith and we persevered. And I was strengthened by the fact that I knew that we had outstanding treatment, and the care that I needed I could get right here in Arkansas. Thanks to an incredible medical team and the grace of God, I'm thankful to say that I'm now almost exactly 3 years cancer-free. An exciting and monumental thing that wouldn't have happened if I didn't have access to the type of critical care that the people in this room provide. My mom had her own battle with cancer when she was just 20 years old and a newlywed. She was actually diagnosed with spine cancer. She had her entire life in front of her, and the next she was told she may not live. If she did live, she would never walk, and if she walked, she would most certainly never have kids. Well, my mom, if you've ever met her, is not going to be told no very easily, and Janet Huckabee proved them all wrong. She's still doing that a lot these days. Not only did she live and walk again, but she ran a marathon, had 3 kids, and now is a proud grandmother to 7 grandkids. My mom defied the odds like so many who have faced a tough diagnosis, and she was blessed to have incredible doctors and specialists right here in Arkansas supporting her and caring for her every single step of the way. And that's why we're here to celebrate physicians from all across our state, from major hospitals here in Little Rock to family practices in small towns in the Delta and the Ozarks. Each of you are there for Arkansans when we need it the very most. As you work to make Arkansas a healthier state, my administration hopes to work alongside you. And thanks to the One Big Beautiful Bill, and as many of you are aware, and as Dr. Connor mentioned, the Federal Rural Health Transformation Program will infuse our state with $500 million in assistance to providers in our smaller counties. We've also launched an initiative to improve our state's maternal health statistics, and earlier this year we were proud to direct $45 million in new funding to maternal health care through the Healthy Moms, Healthy Babies Act, and we're making tremendous progress. We've worked hard to help every Arkansan lead a healthier life, including by making our state the first in the South to offer free school breakfast to every single public school student, getting taxpayer-funded candy and soft drinks off of food stamps, and getting our kids off screens and outdoors through the Natural State Initiative. But make no mistake, everything that we do that is positive at the Capitol cannot replace the work that you do every single day caring for Arkansans. We're incredibly grateful for the doctors, for the medical staff, and the team that are here in Arkansas helping move our state forward and taking care of us when we need it the very most. So I want to say thank you again for all of your work, to your commitment to our state, for the way that you make every Arkansan proud, help all 3 million people lead better, healthier lives, and have a higher quality of life. Without you, frankly, we wouldn't be here. So we're very grateful for the work that you do, for your commitment to our state. And I want to once again say congratulations to the Arkansas Medical Society's 150th birthday, and welcome to the Arkansas Governor's Mansion. Thank you for being here today and what you do.
Good morning, Governor Sanders, and thank you so much for hosting us here today. On behalf of the Arkansas Medical Society and as a small-town family doc that still delivers babies in Camden, thank you for hosting us. And it's my great honor to be able to present to you this framed piece. It includes our 150th year anniversary commemorative magazine cover, as well as your official proclamation declaring 2025 the year of the Arkansas physician. This recognition has meant a lot to all of our physician members across the state. I think it highlights the dedication, commitment, and service of physicians who have cared for Arkansans for a generation. And I think it also highlights the important partnership between our medical community and our state leadership in making sure that every Arkansan has access to good health and is improving their health, and we appreciate that so much. I want to thank you for helping us mark this historic milestone, and just thank you again for your support for Arkansas physicians and for those patients that we serve.